This is a patient of conjunctival chemosis. The cause of conjunctival chemosis is any reaction, allergic reaction, any irritation. There you can see in this case there is also opaque cornea, there is no vision already in the eye of the patient, and there is so much conjunctival chemosis. What is conjunctival chemosis? Conjunctival chemosis is swelling in the outer layer of the eye, which is called as conjunctiva. Sometimes the conjunctival chemosis is so much and patient cannot close the eyes. In case of this patient, there is watering and there is also bleeding from the eye of the patient. The treatment of the conjunctival chemosis is cold compresses and antihistamines. Because in case of conjunctival chemosis, patient complains of irritation, watering and pain. These are symptoms. To relief of the symptoms, we will prescribe antihistamines and cold compresses and lubricants like tears nature, tears plus etc, etc, so that the symptoms will relieve. In case of some doctors, in case of severe chemosis, some doctors prescribe steroids to decrease the inflammation. Also in some cases patient in case of bacterial conjunctivitis or viral conjunctivitis, doctors also provide antibacterial and antifungal medicines to control bacterial conjunctivitis or viral conjunctivitis. In this case there is only swelling and watering and bleeding. We will provide antihistamine, antibacterial and lubricants, and also we will prescribe the cold compresses. Thank you so much.